Good evening and welcome to Thundermist Virtual Back to School Q&A. My name is Christina Mary Pinson, family nurse practitioner at Thundermist South County. We have two additional Thundermist experts with us tonight, Jessica Douglas, family nurse practitioner, and Kristen Zaleski, behavioral health clinician. Jessica and Kristen spend a portion of their time working at the school-based health Thundermist has at Deering Middle School in West Warwick. They're familiar with schools, they're familiar with care. Many families, back-to-school planning will be before. Your school will have new policies in place to prevent the spread of COVID-19. You may also be starting the school year with virtual learning. Whatever you're doing, we want you to have good information, prepare your kids for the school year, and keep your whole family healthy. Going back to school during the COVID-19 pandemic will be challenging for both children. Keeping yourself and your family safe and healthy is the most important thing you can do for your family. The pandemic solved a lot of questions. The unknown can be stressful. Learning from stress is another important aspect of keeping your family safe. Please put your questions in the comment section and we will do our best for you. Let's get started.
Hi, I'm Jessica Douglas. I'm the family nurse practitioner at Thundermist Health Center in the school-based health center at Deering Middle School, otherwise known as the Health Hut.
And I'm Kristen Zaleski. I'm a licensed clinical social worker who works only at the Health Hut at Deering Middle School, also in West Warwick, and we work with the West Warwick High School students as well.
Okay, let's get going. Kristen, there's still a lot we don't know about this school year. How do we help our family deal with the uncertainty?
You know, the conversations we've been having since March, we continue, I think, just to follow the governor's guidelines, which I think have been really great and strong for the state of Rhode Island. We're all watching the numbers. We're all waiting for that big announcement. Are we going to go back to school? Are we not? Are we going to start with distance learning? Are we not? But that's how our lives have kind of been since March. It's been a kind of a waiting game, and we have to adjust as families, and we have to have these conversations and let kids talk about their concerns and, well, what if I don't get to see my friends? And for parents, I think validating these feelings, these kids are the unsung heroes of COVID-19. Their lives were more disrupted than all of us. Yes, do we work from home now and we do our grocery shopping a different way, but we still get, we live with our families and our work is our life for the most part, but these kids, they don't get to see their friends and they don't get to get that support that they get from their peers or from groups at school or clubs at school. And just reminding kids that life isn't linear, things don't happen black and white, as we see even in today's news. We're learning as we go, and we just have to support our students, support our families. It's okay for parents to have questions and say, I don't know, we're waiting for that answer. But this is what we can do as a family to do the best that we can with the information we're given right now, and know that tomorrow the information might be different. And as a family, we'll make a really good decision together. I don't know if you have more to add to that, Jess, knowing our families. I mean, I think we have some really strong families that we work with in the Health Hut, and knowing that they can lean on Thundermist even as a support is a nice thing.
Yep, and I think the point you make about keeping the conversation open and asking the kids, what their thoughts are and if they have specific questions or fears, to keep the conversation going. My tendency as a parent often is to not overshare because I worry that I might create anxiety. That's not necessary, but I've learned along the way, and I think this is one of those really good examples where the more conversation we have, the better off my kids seem to respond. And I think that's how we handle addressing difficult issues with the kids in the school-based. We are the safe place to ask the questions. So that's just sort of, for me, just reaffirmed that that's helpful for them, and they need to hear the adults ask, are you okay? Or what are your thoughts? Or what are you worried about? And it's okay to answer them honestly.
Yeah, and remind our families there's no wrong answer. Whatever you as a family decide is the right answer for your family, if it's only distance learning for the year, or it's a new homeschooling program, or it's trying to go back to school because it relieves anxiety to be in a school building for some kids, then that's the right answer for your family. As long as we're following those guidelines that we can as closely as we can for safety, then that's the right answer for your family.
Excellent. All right. Jessica, how can parents prepare for their children for how this school year will be different?
So I will start by saying, again, have the conversations, be honest with them about the changes that they anticipate. Schedule changes are something important to start talking about. If you are planning, again, things are up in the air, but things that we think of that are important for school-aged children, teenagers, all school-aged kids, good sleep, good nutrition, and trying to, COVID has been a little rough on all of us for all of these things. And it's been different for everybody. But then we've just come off of a difficult summer. And so typically this is the time of year where we tell our parents during well child checks that this is when we want to start introducing back some type of a normalcy routine where we start to maybe have some more family meals or make some better food choices or start setting bedtimes a little bit earlier, start limiting some of the, screen time that we're doing, the recreational screen time, whatever it is that works, that how you manage your family, and what your activities are. Now's the time to get the rest of the routines in place that are going to make your day better. Kids really thrive on structure, and they lean on the adults to help them set that structure. So sort of following in line with them and creating a routine now is just going to make it easier. We've got a few weeks. You've got an additional 2 weeks before the 14th happens. So now is a good time to definitely start. And then the other thing I think is really important is talking about masks and making sure kids are aware that they're going to need to be wearing them. And I think that's probably the plan across the board, for the schools. They're all going to be masked up. But having that conversation with them about what that might be like. And again, the uncertainty is big, but it's okay to say you don't know. There's going to be a lot of practice, I presume, when they do start back, if they do start back in person, with managing the masks, but that's going to be a really important way to keep them healthy. And washing hands and all of that good stuff is going to be exceptionally important. So just working those things into the routine now, I think, is the best place to start.
And to add on to that, Kristen, what are the best strategies to get kids used to wearing a mask?
I think we've been wearing masks since, when were they mandated in Rhode Island? April. I think we've been wearing them in Rhode Island. And even if your kids have been home, like I have an almost 4-year-old and an 18-month-old, we haven't gone anywhere. And even I was talking with Jess earlier, my 3-year-old, he can be difficult, like most 3-year-olds, and he's weird about his hair and haircuts and everything. And my husband and I avoided taking him out anywhere because we're like, he's not going to wear a mask. It's just not going to happen. But watching us wear masks, watching his aunts and grandmas and grandpas and his friends that he did see, in limited capacities, and neighbors walking with masks on, it seemed a little more normal to him. And we ordered the Fun Prince and the Paw Patrol and the Lightning McQueen, and we give him lots of choices, and we never pick the mask for him. He gets to pick. And I think that's always a really good strategy with kids that aren't sure about things, is let them have a choice in it. As Jess said earlier, start practicing now. If your child has not worn masks or seems uncomfortable wearing masks, with masks, a lot of kids have some sensory issues, the tightness on their face, maybe some difficulty with breathing. There's so many nice options now. We have face shields, we have those things that go in the back of your head that your mask can clip onto if your child has, an issue with the strings going around the ears, or we have the kind that tie, or, and I think schools will be flexible with how a child wears a mask, because a child that has sensory issues, the school's going to be aware of that more than likely, and can help. But practice. Look up your kid's favorite characters wearing a mask. Superman wearing a mask. I'm sure if I Googled it right now, I could find a picture of Superman wearing a mask and make it cool, and choices. And that's all we can do is practice. Again, we have, 3 weeks now before school gets really rolling, and, we do some mask time in the house while they're on their iPads, like kind of to mimic the school time. And they'll get it. Kids are flexible. And when they see that it's the new norm, it's not so abnormal. They really get comfortable quickly, especially when they see their peers doing it. The power of peer pressure can be a very good thing in very, 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 very small amounts. And I think wearing a mask is one of them. Their friends are wearing a mask, they're going to wear a mask too.
Yeah. Okay. Now, Jessica, what should we be telling kids to do to stay safe at
So first and foremost is to listen to your teachers and for them to listen to the rules and the guidelines set up. That's the only way that this is going to work for them, and that's what's going to keep them safe. I think that the hardest part for the kids, we have different age groups, right, that have different issues. And so we've got to kind of keep our hands to ourselves. We've got to keep our masks on. We've got to not touch our face mask, which is something like I struggle with sometimes, and I'm reminding my children of a lot. But that's, of course, where a lot of germs are, so we don't want to be doing that. The schools seem to be very specific in their outlines that they'll have hand washing time and sanitizing time, and so that's going to be really important. And hopefully by now they're already into that, but this is the time again to start making sure, especially before and after meal times, as they enter and exit a classroom, they need to be washing their hands, practicing social distancing and following those rules and staying in your assigned seat, even though that might be irritating and you can't sit right next to your friend. These are really important things. The other things that I was thinking about these questions ahead of time, obviously, I always tell my kids not to share cups and things like that, but I think that this is something that's going to have to just be a little bit more reinforced. We forget to say things like that now because we are so social distanced and we are wearing masks and we're so focused on that I think we need to go back a little bit to the basics about maybe just not sharing snacks and not putting your hand in someone's bag. And they might not necessarily be close enough for that to be a big thing, but it's impossible for us to prevent everything. So just giving them little reminders about that would be good. And then, of course, parents, it's our job. We've really got to keep them home when they're sick. That's the hardest part, but that's what's going to keep them safe, and their teachers safe, and their staff safe, and the administration and those people who've been working so hard to get them back and give them a good, solid education. We have to pay attention. And that's a really difficult thing to do. And it comes at a high price for lots of people. We work, lots of parents work, and hopefully employers will continue to be flexible about that. But I think that's really the number one priority that we as parents have to do. And then the other major thing is these kids need immunizations. We've spent a long time avoiding the doctor's offices for good reason. We weren't bringing kids into our office for the first couple of months for safety's sake, of course, and to limit spread. And at this point, we're seeing plenty of well child visits in the office when they're due for a physical. And it's really, really important that we get them immunized so that we're not dealing with other health issues that we could be preventing that come up and cause this pandemic to become much bigger than it already is. We don't need to compound multiple disease issues on top of what we're already dealing with. And we don't want our kindergartners going into kindergarten without their full vaccines. We don't need to start seeing chickenpox happening and, God forbid, worse, measles outbreaks, things like that. And the flu shot. So that's coming soon. And we can't say enough about getting your kids in to get immunized.
I think another thing right now, we're sort of at a low transmission rate at this point. Right. The more people we can get immunized at this point when things are sort of in this, and exactly. I don't mean to say low, but we're at a lower transmission rate right now.
Now is a good time to come in. Now is a great time to come in and get all settled for the year.
Yeah. Kristen, tell us more about the Health Hut. What is it, and how can people get care there?
So Thundermist has two health huts. We have one in West Warwick and we have one in Woonsocket. So Jess and I work at the one in West Warwick with the Deering Middle School and the West Warwick High School. We're actually located in Deering in the middle school with the school nurse, but we do see the high schoolers as well. The health hut is wonderful. I mean, we're always trying to get the health hut news out there, and we're always shocked about how many parents have had kids in West Warwick since kindergarten, first grade, even coming through the middle school, and now they're in 11th grade, and they're like, I didn't know you were here. But we're a mini clinic. We're a mini Thundermist in the school. Jess is a nurse practitioner. I'm a behavioral health clinician. We have medical assistant there. We can do physicals, immunizations. I provide counseling for students, continue to provide counseling over the summer this year because of COVID. And we have just lots and lots of services. If you're, in a typical non-COVID year, if your child is at school and maybe not feeling well and you're not sure if it's something more serious, if they need to see a doctor, they can go right down to the health hut, see Jessica, have, a strep test done or a flu swab done during the flu season, and know right then and there if they need treatment, it can be called in. And we work really closely and collaboratively together, as well as with the Thundermist clinic. So even when the school is closed, Thundermist Health Hut patients can still be seen at the main site. And it's great. The Health Hut does not have copays, so it's really actually a nice feature for families. It relieves some of the financial burden that sometimes going to the doctors can cause. And also we have nice access at the Health Hut because it's the whole school day, and Jessica's there and I'm there, and we work with families and we have great communication with our families. And you can sign up and you can be a Health Hut only patient, or you can be a Thundermist only patient, or you can be both. And we encourage all West Warwick students and Woonsocket to sign up, because it really is a wonderful place. And I've been there. This will be my 9th school year starting, and I love it. I wouldn't change my job if I had a choice. If there was some dream job out there, I'm working it. So working at the Health Hut really it's great, and it's a great place to come and have your children seen by nurse practitioners and great staff.
That's excellent. And it sounds like it can be really seamless, where you can kind of continue your care throughout the summer, which is great. And I mean, as we all know, Thundermist provides a lifetime of care from infancy straight through to, geriatrics. So you can kind of just think of that, which is wonderful.
Absolutely. And, a lot of our kids have Dr. Storms as their pediatrician, for an example, in West Warwick, but, her schedule can be tight. She's busy. You're not feeling well, they can go see Jessica. Jessica's going to be able to share that information with Dr. Storms as the visit's happening if it needs to. So there's no lapse. The care coordination is perfect, in my opinion, because we communicate with the team. We're on the same system as the whole team. So it's really wonderful.
We have another nurse practitioner, Jamie Borden, who shares the Health Hut NP role with me. So I'm there 3 days a week and she's there 2 days a week. And we're in constant contact and we cover for each other. We look over each other's tasks and messages and things like that. So it really is a very tight-knit, well-covered, well-oiled machine at this point. I mean, we do a lot of stuff.
Social services, through medical services to family counseling. We can make referrals. We can do all the things that you can do at the main site. So
yeah, that's excellent.
Yeah.
And just the accessibility is so great for kids.
Well,
if transportation is an issue, if any of those things pop up, you guys are just great.
And we've had instances where we, provide nebulizers, multiple, treatments throughout the day for a kid who has asthma and just needs that neb twice during the day, but really can function and make it through the day. And that saves the parents a day out of work.
Right.
And they're being assessed throughout the entire day. We stock more medications, and we're able to give more medications than the standing orders in the district go. So, we can give, Tylenol and ibuprofen, and they know that we're the ones who have the cough drops, because that's not a standing order in a lot of schools. So something as simple as that, or Tums or something when it's appropriate, can be really helpful and just enough to get the kid out the door back to class with a smile on their face. So,
and keep them in school, which makes a big difference too. I'm sure kids are sometimes going home with something that can be very well managed.
Absolutely. And it does keep, the frequent flyers who may be trying to get out of school for various reasons. Sometimes we are kind of a last line of defense. You made it past the nurse, but you're okay. You can go back to class. And that's where having behavioral health there, my own role, we can work with all those different issues that come up as well. So it's not always medical, that's keeping them out of class.
Right. And just to reinforce this, Jessica, why exactly are the immunizations so important this year?
It's just, as I said before, it's just so imperative that we give our kids the best protection that we can right now, especially because we're in the middle of this pandemic and everyone is vulnerable at this point. We don't want them to be behind on immunity to things that we have done an excellent job as a nation for, immunizing against. We battled these things. We wouldn't have immunizations if we didn't know that they were a problem. And we don't want these diseases back. And again, to talk about traumatizing and difficult would be to have outbreaks of measles and varicella or chickenpox amongst dealing with COVID and flu and things of, like that. We just don't need to compound the issue. But the earlier we get kids immunized and the better we stay on their immunization schedule, the better they're going to be for, lasting immunity and good health throughout the school year. So now is the time. You made a very good point about us having a lower transmission rate right now. Most pediatrician offices, doctors' offices, family medicine offices, community health centers have very good rules in place about who can come in the building and who can't. And we all have different strategies for how we're managing sick visits versus well visits. So it's absolutely safe to come to Thundermist or any other provider's office, following their guidelines. I think the chances of you getting COVID or ill at the doctor's office right now are pretty small, given all the steps that I know we're taking as a health center. So my kids came in for their physical last week, 2 weeks ago. They're immunized and ready to go. I wouldn't have brought them in if we didn't think it was safe. So I'm hopeful that sends a good message to other parents and that they can feel a little less stressed about it, because it's scary.
It is. I think another piece that I don't think we mentioned yet, I really think it's important for kids to get outside. It's a good resource to get them exercise, to get moving. So as we kind of get back to this routine, building in some exercise. I know there's a lot of kids who have lost sort of organized sports. So if they have the opportunity to get outside, go for a walk, go for, any kind of movement, kind of helps with having to sit still and in classroom, all that extra kind of good overall health, physical and mental.
Absolutely.
Agreed.
Okay, so we'll be answering any questions that are in the comments. You can feel free to leave questions if you have anything that you want to ask. I have one. My child doesn't like to wear a mask. How do I get them to wear one?
So we kind of touched on that earlier, and Jess and Christine, please feel free to pop into, you're working with kids during all of this as well. But again, I think it's practice, exposure to adults wearing them, exposure to preferred, people in their lives wearing them, making it fun, making it a game, sticker reward charts, for younger kids. Oh, you wore your mask for 15 minutes today. You did an awesome job. It doesn't have to be a huge reward. It can be, we'll order you your favorite print on your next mask. We're going to need masks for a while. So having, we all have our plethora of masks now, and just, I think, practice. And again, identifying if there's any sensory issues or anything with where the mask is. There's so many different kinds out there to try. And now is the time to try it, because we have a couple weeks until school starts. If you need to make modifications with the buttons so that the strings are on buttons, or it connects to a hair tie, or, whatever works for your child, for your family, and for your child. There's lots of strategies, but again, practice.
I would also just add, as a parent of a child with glasses, 2 children with glasses, that has been a challenge. So if you haven't figured it out now, which ones work best for them, now is really the time to do it, because it's going to be really annoying when they're learning and they're fogging. Yeah. So, we've had a little bit of a tough time figuring out what works for us, but that's really going to be important.
Yeah. I think, and this sounds really silly, but Pinterest and anything like that has really great options for how to modify masks and different things you can do. I've put a couple pipe cleaners in the cross of the top and pushed it down here so that you get that nice fit, so that I don't fog up, because fogging is definitely one of my things. So those things are good resources for places to look and identify different tools and strategies, or headbands with buttons, or whatever you can do to make them.
Definitely. And I was going to add to that too, practicing, especially with the little kids, making sure you're covering the nose. My son slips down and we're in the store, and I'm always putting it back up, and now he's getting it. He knows it needs to stay, above his nose. He thinks he's doing a great job when it's just down here, but, reminding the younger kids, it's got to be all the way up the nose. So
yes.
Reinforce.
Right. I don't think we have any more questions right now. So I'm just going to say thank you to everyone. We hope you enjoyed getting to know our providers, and we hope you were able to answer your questions. Please remember that kids entering kindergarten and middle school need immunizations. You can call 401-767-4100 for an appointment. Again, 401-767-4100. And it's especially important that everyone gets their flu shot this year. The flu shot will be available in early fall. And just so you know, Thundermist is accepting new patients of all ages. You can call again that number, 401-767-4100 for an appointment. Thanks, everyone.
Thank you.
Thank you. Thanks, Christine.